Okay, so at this point, we would like to make some opportunity to take comments and questions from those people who have come here today to be with us.
I'd like to comment how, from a consumer carer point of view, I'm very, very grateful for hearing Kathy Kesselman's comments about moving from a straight medical model to one that listens to, attends to, and makes the carer's role important. And I'd like the panel to comment on what they think the future might be 5 years from now. How will that look for carers presenting themselves in a mental health situation?
Well, hopefully what it will mean is that carers also have a much bigger say, and that their voices are heard, and not just heard, but really make a difference. That carers are there working with people on recovery journeys every day, and their needs, as well as those that they're supporting, really are absolutely crucial to good outcomes in mental health. So my view for the future is that we see a much greater role for carers and consumers at the centre of our system.
Thank you for asking that question. I think it's a really integral question to how we move forward in relation to providing meaningful services to both consumers and carers. Some of the feedback that I have had from students who have engaged in placements within Uniting Care Mental Health, one of the very first things we do, and in fact the first thing we do, is we sit our students with one of our consumer representatives so that they can understand participatory decision-making processes, the rights and responsibilities of carers and consumers within the service, and how that works in partnership with service delivery and development of collaborative service plans that do include carers and consumers. So it's a really important question.
5 years from now, I'd like to see more consumers and carers employed as practice educators through growth of peer workforce.
Hayden, I'm the Sydney ICTN coordinator, and so it's been my pleasure to see this project get off the ground. As we've been hearing, this kind of project was exactly the sort of project that HWA had envisaged in the broad parameters of looking and the priority areas of looking at mental health in the cross-sector and in collaboration with partners. So if I could just ask perhaps Karen or anyone else on the panel, do you agree that these findings and the outcome of this project will indeed look to increase clinical placement capacity in the practice sector in community managed mental health placements?
I would like to say I very much hope so. One of the comments I would like to make is as we move forward within this sector, we are looking at providing more and more integrated models of working with other organisations in a far more collaborative way. So not only will community managed organisations be themselves employing more clinicians, they will have extensive relationships and networks into the community with other clinical streams as well. So therefore, increasing our capacity to support the development of that process is vital to community managed organisations into the future, but also providing the opportunity for those student clinicians to engage with a wide range of people who are already working in the community managed sector and to understand how we can pull that together and move forward. So I think the answer is that it is something that we as the community managed sector really need to support, grab hold of and get behind to be able to make sure that we can do this.
Lindy, I'm sensing you may want to comment on
Yeah, I
this.
do. Thanks, Tina.
Yeah.
Just in answer to that question, as I alluded to before, this is a great project because by involving students in these models of care, it's actually modelling where we want health and social care to be going, away from a very hospital-based medical model of care. And so having the capacity to increase student education in these sectors is really going to have a profound change on the future workforce and how they think about delivering services and also where those services will be delivered.
Yeah, I think also with Health Workforce Australia's 2025 projections regarding the shortages of doctors and nurses for mental health, that these sorts of interprofessional, interdisciplinary, intersectoral, these sorts of integrated approaches are very much where the future lies. Yeah. Other questions from our audience? Yes.
I really wanted to follow on from what Lindy was just saying and ask her how you think these placements will impact cross-disciplinary culture between the different professions in terms of a sort of cultural shift.
Yeah. Look, students really only learn about interprofessional practice by engaging in it. So while we do a lot of university-based education about the importance of teamwork and the skills and attributes required for it, and talk about different models of interprofessional practice, you really learn this in the setting, the practice setting. And so the more of these learning opportunities we can afford for students, the better everyone's interprofessional teamwork skills are going to be at the end of it.
So do you think it will remove some of the sort of hierarchical thinking around different professions and disciplines?
I think if we're going to seriously change the way services are delivered in this country, we have to provide learning experiences that model the most appropriate way of delivering services, and that the people who head the teams should be the professional grouping that are most relevant to the client and the carer's needs at that time. So I'm hoping that one of the things that will come out of this project is the traditional leadership models of delivering services.
I'm Bethany Hart from the University of Notre Dame, Sydney. So just thinking about the role of the education providers in this, and recognising that this project is a part of a huge cultural shift that now acknowledges recovery-focused care and trauma-informed care. So recognising that and thinking that in a way the community organisations are leading the education providers in some ways. They're leading them to understand and to rethink some of the teaching that they do, and to rethink some of the placements that they might have traditionally or previously thought as being the way to go. So I guess from each of you, just a comment about where you think the education providers might sit in this project as it moves into the future. What might be their responsibilities, or what might be the ways in which they can move and support the cultural shift that's already happening?
I can give you a live in the drive example. Uniting Care Mental Health is the lead agency of 3 Headspace sites, and a university is a consortium member and has worked wonderfully with us. We've been sharing placements together for many years in relation to medical students. At a consortium meeting recently, the university obviously has been exposed to a wide range of service providers, which includes reproductive health providers, vocational employment providers, Medicare locals, a really broad range of people. And it came to an understanding that maybe it would be really helpful to have med students not only engaging with Uniting Care Mental Health, but everyone around the table, vocational providers. So it's still in the context related to mental health, but how does mental health impact a person's ability and experiences around employment? Does a person who experiences mental health issues need the same kind of assistance that we do in relation to reproductive health, or something different? So that was a live in the drive example of how a university adapted its original thinking around student placements to become far more inclusive and far more innovative.
So we're already well down the path of refocusing our student placement programs away from traditional medical model high-tech hospital settings into the settings where the demand is growing, and that's aged care, disability, mental health and community. And that's why this is a great opportunity for us to collaborate, because that's exactly the sector that we're looking for. This is where healthcare is going to be delivered in the future more and more. That's what I was referring to before about this project leads the direction of change that's desperately needed for the delivery of services.
I just wanted to build on what you were saying before, and I think the whole issue is around education and awareness. As we start to break down silos and traditional ways of thinking and build those relationships, we can start to change and shift paradigms and thinking. And we were talking about changing hierarchies. I suppose the first hierarchy we've changed and are in the process of changing is the one of the consumer and the carer, being at the core of service delivery. And we need to do similar things with disciplines and with across different sectors and models, so that it's a matter of collaboration and working together and care coordination, real teamwork.
So I was just going to ask Karen, what were some of the benefits of taking on student placements for the organisation or for the NGO?
I think there are quite a wide range of benefits. Some of those we have discussed in relation to the ability to start to recruit for our organisations for the future, given that we have been discussing that we are working within a dynamic framework around mental health which is changing quite rapidly. So therefore we need to be planning in advance for it, what our workforce is going to look like in this changing environment. So being able to engage with students at the very beginning so that they have an understanding of what we do now and what we might do in the future is really important. I also think that community managed organisations have sets of values which go beyond just service delivery. It's also about contributing to the community, and one of the ways that we can contribute to the community is to support the professional development of students, because they live in our communities, they work in our communities, and they also use our services. So we are, we hope, contributing to local communities by doing that. We've also seen that the relationships that we have held with educational institutions, predominantly universities, has led to other bonuses for our organisation. The relationship has formed, and as we've formed, we'd realised what else we can do together, which has included research, which has included shared understandings and models around clients and service provision, and that relationship is only continuing to grow, and that's been a real benefit for us, and we hope the university as well.
Would anyone like to add to that based on our
Well, just perhaps to add that the opportunities that working with this sector creates for the higher education providers in terms of placements, there is a quid pro quo, and that is that when university students are placed in sites and organisations, there is a support mechanism in place for the supervisors taking those students, and, as you alluded to, for the organisations more generally, Karen. So the university provider placement, university higher education providers who will put forward their students for placements in this sector will continue to provide support in the forms of workshops and a whole lot of capacity building for staff within these organisations.
I would also comment that community managed organisations do need to make sure that they have the capacity within a position within the organisation who has the bandwidth within the role to the relationship building with the educational institution to ensure that the students have a point of contact, that you have policies and procedures and the ability to support those students within the placements as well. Yeah.
And we might wind down the question and answer session at that point. Thank you all for your questions. It was wonderful to see so many. I'm not